Hi guys, welcome back to the Fix My Posture series. I'm Dr. Blemiers and we've been running this posture series. I hope you've watched the movement for your neck and movement for your thoracic spine. Today we're talking about movement in your lower back. Now, having said this, I know there's a lot of people that have been struggling with lower back pain recently, and there's a post that I made recently that just said, hey, pain is not normal. And I know a lot of you probably think that it is, but I want to remind you that it isn't, right? And taking painkillers for something like musculoskeletal disorders is not the best thing if you're not looking at physical therapy, right? So whether it's your physiotherapist or your chiropractors, there are so many options for you to strengthen up your lower back, so many options to strengthen up your core. And in this case, what we're looking at is just bringing joint health into the picture, right? If you've been sitting for a long time, once again, you are flexion dominant. So I've spoken about flexion dominance in the video with the neck when we're talking about cell phone use, flexion dominance when we're talking about computer use, and flexion dominant when we're talking about sitting on chairs for 8 hours for some of you. Apparently we sit about an average of 12 hours and we're only supposed to be sitting for about 20 minutes at a time. So I do have a video up where I've spoken about sitting and standing and having that practice, and it's just important to have that practice. Well, here's the thing is, if you're going to do the sit stand, you're going to do the walking around your office, you're going to do the standing desk, here's a really nice exercise that you can do in the office. You don't have to be in workout clothes, you can be in your work clothes and you can still get this done, right? So we've spoken about controlled articular rotations. Now this is literally just knowing what movement your joint is allowed to make and then just doing them and practicing them, right? Because our joints need movement for nutrition, and so do our discs. Now I do have videos up on disc movements, so I hope that you've watched that and you've started incorporating that into your daily practice. So for the lumbar spine, which is very similar to the thoracic spine, it's just we're kind of taking our body a little bit further into the motion, right? So for our lumbar spine, we want to go, our lumbar spine allows us to go into flexion, so flexion bending forward, so we've got some flexion, and then we've also got some lateral bending, and so that is something that we have, and then we've got some extension, which is a little bit further back, right, and then we've got a little bit of our rotation, right? Now, this way, what you want to do for this one is that as you go into your flexion for your lumbar spine, what you're going to do is you're going to bend forward. But in the thoracic spine, we kind of bent up until the point where we felt like our break was here. But now we want to actually bend all the way forward until we get to the point where we feel like our pelvis is about to tilt forward. And that's the point that you stop, right? Because what we're looking at is the joints in our lumbar spine. Lumbar spine being from your mid-back right down to your pelvis. So we've got ourselves in that. If you're standing just strong and you've got yourself bending forward, and then once you feel like your pelvis is about to shift, you can take yourself into that lateral, into some rotation, so rotation, and then you're going to take yourself into some lateral bending, some extension, and that may look a little bit further back, right? And then you're going to come into your lateral bending, some rotation, and then you're going to move back into flexion. Now, there's a few things I want you to remember when you're doing this, right? Understand that your body works according to input, right? So if you've been sitting in flexion for a long time, the extension may actually be protected. So you want to watch when you're going into motions that you haven't previously gone into. So if it feels like your friend may be able to bend a little bit further back than you, that's okay. Trust where you are and you will grow. Just practice that, right? So what we want you to do is just start practicing all these ranges of motion and making sure that your joints stay healthy. And the more that you move, the more movement is allowed in your body and the more health is allowed in your body. So I hope that this has helped you. Please let us know how it's been going. If you have any questions, please feel free to ask. Thanks, guys.